Okay, got my scratch on my head before you started, huh? Good afternoon, everybody. I want to thank you for joining me today on our weekly COVID-19 update. This is your County Executive Ed Day. First off, we'll give you an update on our numbers. The end of the day, actually, we updated this to today. There are 382 active cases of COVID-19 here in Rockland County. That is up from 272 active cases that we had last week. But it's still barely more than 1/10 of the entire population. So we like to try to put things in perspective and balance when we give you these numbers. For clarity, our active numbers are based on confirmed positive results dated from the last 2 weeks. It's a 2-week running schedule because that's the incubation period essentially. So when you enter that count, you're in it for 2 weeks and then you leave it. And other people obviously will be coming in too. So it's first in, first out of that grouping. And these are the reports that go to our Department of Health. Please keep in mind that an active case denotes a person who is tested positive. It does not mean that they are symptomatic or seriously ill, but they can be contagious, obviously. So the information is important, but it does not speak to seriousness of the virus on any particular person. Because in fact, the hospitalization rates remain very, very low. Today, there are 6 people hospitalized and confirmed to have COVID-19, with 1 under investigation. Again, compare that to where we were. We were pushing around 400 people in our 2 hospitals. And again, our health and planning department are keeping an extremely close watch on each new positive case. We're going to segue into something relating to this a little bit later on in the broadcast. And I invite you to check out these resources which are launched last week, and this is for you to see. When you visit our rocklandgov.com website, rocklandgov.com, you'll see a link to our dashboard hub page, which has our map on pause and early warning dashboards in one place. There are also links that go to John Hopkins University and New York State trackers that look at the experiences we're having when it comes to COVID-19. But as we all continue to watch these numbers, I remind all our residents, in order to keep local business and the economy moving in the right direction, we must keep the numbers low. We do not want to give the governor any excuses to shut our businesses down. That would just be unbearable, unacceptable. And again, I've said this many, many times before. We're not going to wave a magic wand and eradicate this virus overnight. We have to understand, we have to learn to live with this virus. That is not a death sentence. That does not mean you get sick. What that means is practicing common sense efforts to ensure that we do not return to a situation we saw earlier this year when hundreds are hospitalized. And again, bear in mind, at that juncture in time, there was no preparedness. This is a virus that hit us hard. None of the steps we're taking now were even in play at that time, and that allowed the virus to take root. Residents should continue taking the common sense precautions that helped us flatten the curve, and now for us this serious length of time. Stay at least 6 feet apart from other people. Keep your face out of other people's faces. If you're not in the same household, whether it be indoor or outdoor. Social distancing, again, that's common sense too. And also wearing face coverings. That seemingly has helped. And washing your hands. Wash your hands with soap up for 20 seconds and rinse off. The same things you told your kids, you should be doing too now. And also, please, if you are sick, if you feel sick, don't go to work and infect other people. Don't be around other people. Take a day, get better, or a couple of days. And if you have continuing symptoms of anything, especially regarding your lungs, you want to contact your doctor. You can also use hand sanitizers. That's a good substitute when you can't get near soap and water. So again, all these things are common sense. All these things are things that we would do to help keep healthy to begin with, except for the mask issue. That's a wrinkle we weren't taught as kids. But continue doing it, and again, we'll keep those rates down. So with that, I'm going to turn things over to my communications director, John Lyon, who's fielding your questions today. John?
Okay. Thank you, everyone, for writing in today. I'll get right to it. The first question, what has been done in zip codes with higher active case numbers?
Okay. And again, this goes back to what I said earlier. We're going to give some information that speaks directly to the capabilities developed by county government, our planning and our health department. And this is how we found out these things. Again, getting numbers can frighten people, but it's understanding that when we get the numbers, we get it for a reason, so we can take action to deal with any kind of issues. Last week, with the numbers right now, we had 382 current cases in Rockland County. 256 cases have been identified to be in parts of 2 zip codes in Ramapo. That is a fact. It's up around 67% of our cases are clustered in that area. Now, what to do? Well, what we did is last week our Commissioner of Health and myself held a conference call with the municipal and community leaders in these areas. I was very happy to hear that they have been taking a number of prevention efforts, but even they acknowledge it's probably a good idea to redouble it and come up with a further plan of action. So these conversations were already underway, and they were bearing fruit in the coming days. The town of Ramapo issued a press release on Friday, which detailed the outreach and the prevention efforts that they've undertaken recently. And I'm going to just touch base on a couple. They've done a number of things, which I'm not going to go into, but they helped facilitate and circulate a letter from approximately 24 local medical professionals about the importance of wearing masks and keeping people safe. There are people out there who still do not believe this is serious. So we're getting people who are respected and known in their community to speak to these issues and make sure people understand that this virus is serious. And it's important that they do what they need to do to knock these numbers down so they mirror the rest of the county. They distributed masks in several local supermarkets, which they then gave out to the public, and there was photo and video available of that. They reinstituted the English Yiddish hotline and regular calls with community leaders, which includes updates from New York State and from the Rockland County Executive. They began airing loudspeaker announcements throughout the town, and they opened localized flu shot centers based on recommendations from the medical community. So that's just some of the things that they've been doing. And again, when we identify the problem, we want to make sure we can take action to address the problem. So this is something that's being done jointly with the town of Ramapo, local community leaders, local religious leaders, to address this uptick that we're seeing in part of 2 zip codes in the town of Ramapo. And I agree with the town has stated already. Sustained vigilance is absolutely required. They are encouraging all town residents the same way I'm encouraging you here right now. Practice social distancing, wear a face covering, engage in regular hand washing in an attempt to curtail the spread of COVID-19. And I certainly could not disagree with those sentiments. I could not agree with those sentiments more.
Okay. On to the next question. Another person wrote in with concerns about a specific store where employees were either not wearing their masks or not wearing them properly. They asked what can be done. They said that they wrote that they had contacted people. Everyone they spoke to was really just passing the buck and pointing fingers. What can you say to them?
Okay, look, I understand this frustration out there, but nobody's passing the buck. And I'm going to lay it out for you because I've read some of the comments that were there, and frankly, they're a bit over the top. So I'm just going to be very direct with you, and if you who want to wrote it, you'll understand very directly. Law enforcement agencies that is specifically empowered to enforce the governor's executive orders. Please understand what I'm saying to you. The executive orders can only be enforced by law enforcement. That's number one. If a local business is not taking action, you can try calling the ownership or corporation if there is one. That could be very effective. Oftentimes, corporations and the owners do not know what you're seeing. Share it with them. Contact the head office. If the local police are not doing anything, either you can go to their supervising authority, either the village mayor or the board or the town supervisor and board. But understand something else. If they get a call about people not wearing face coverings, let's be honest, it's going to be a little later in a response. If there are other serious issues going on, it's going to fall back in the queue just as a matter of routine. I can tell you that as a former law enforcement officer. So, again, you call the police. Their job is not to be arresting people. They're going to be educating people, making a point, and they do that. But to say nothing's being done, frankly, is grossly inaccurate. I can tell you that bingo in Spring Valley was shut down by the village of Spring Valley in a concerted effort because of repeated complaints. Bounce in Clarkstown was another issue that the town of Clarkstown was dealing with, and what they did is they cite these places. It goes to the courts. Now, a number of the courts were closed still, So you're not allowed to just go in. I know the governor does it with this SLA, but you cannot summarily walk into a place based upon a violation of this order and shut them down. You have to find them. If you see other things that are going on, you have to find them, and they have a right to their day in court. As that, you may find that maddening, but I would strongly suspect that if you were being cited by law enforcement, you would want your day in court before you were punished. That's just the way it works, and it works the way it works in this country. And again, I know you're frustrated, but county government does not have direct control over a town nor a village. It just doesn't work that way. Their actions, the authorities defined and are limited. As I said, they're directly pursuant to the governor's emergency orders. That's how it works. But that said, we do work, and we will continue to work with municipalities to try to address these issues. And we will use joint strategies. And one of the strategies we used with Santa Clark's Town, for example, we had a health department visited. They went with their code inspectors to go deal with one particular issue. And we did cite them on unrelated to COVID issues that were health department or sanitary code related. And the building and zoning people went out, the building inspectors, and dealt with the issues there. So we do work together to get this done. Nobody's ignoring anybody right here, but at the end of the day, you have to understand that we have defined authority to do certain things, and we do work together to get it done. But again, to say we're doing nothing is grossly inaccurate. And again, bingo is one example, bounce is another, and there are a number of other issues that we work jointly together with towns, villages, and the county people to get things done, and law enforcement also.
Absolutely. And one thing I'd like to add on there, which you and I spoke about earlier, is if you make a call and you don't see something happening, that doesn't mean it's not happening. The response may be later. There may be other things going on that you're not aware of. You're only getting a snapshot of that moment in time.
Yep. I gave it a number. I'll give it out again. 833-789-0470. 833-789-0470. Call that number. What they'll do is first they will make sure that they'll vet the call, number one, that in fact there's a potential violation. That will be offloaded here locally, whether it be the sheriff or the district attorney or our deputy commissioner of health, to see how we can approach this. And that's what happens. You're not seeing it, repeated things that go on. Again, they may have been cited already. They may have a day in court coming up. We don't know that. Obviously, you don't know that. So I just assure you that there's a process. The process is followed in as reasonable a manner as possible. But at the end of the day, you are not going to have 100% compliance. Unfortunately, we're going to have a few knuckleheads out there who don't get it. And we will make our efforts to make sure they understand and go from there. But we have to attempt to get people to abide by these common sense health rules.
And additionally, if you go to a store over and over again and you're not seeing compliance, if there's another store you can go to,
elsewhere.
you can go elsewhere.
And let the manager know why. And let the manager know that you're doing it, and you're going to tell other people the same reason why. This can work. It has worked. So I know that, again, frustration is one thing, but there are ways of utilizing your frustrations for a positive action.
Absolutely. So those were the only questions we received today, but I believe there were a few other items you wanted to mention.
Yes, we were coming down to September 30th. There's 8 days remaining to complete the 2020 U.S. Census. And once again, I'm urging all, if you have not done the census yet, please do so. There's more than $670 billion of federal funds distributed annually based upon census data. And some of those dollars go directly towards programs for our residents depend on, such as health insurance, infrastructure, our schools, and nutrition support. So you still can complete the census form online at my2020census.gov. Again, my2020census.gov. Or by calling, I'll give you a couple of phone numbers you can call. One is 844-330-2020, 844-330-2020. And I'll give you a line for residents who are hearing impaired, 844-467-2020. Well, again, the other numbers for other languages are all available on the census website. And there's another topic I want to bring up again. I do bring this up regularly because I'm a firm believer that it's important we do this, and we're in a near crisis situation when it comes to the area of blood. Our blood supply is challenged right now because before COVID, we had a number of drives that were hosted by our high schools, colleges, businesses, and other organizations. We do this regularly. Our Girl Scouts, Boy Scouts, and it made up about 75% of the region's incoming blood supply. Now think about this. You know people have been sheltering. They have not been going out. There have not been meetings, gatherings, by and large. Clearly, that 75% number has been tremendously challenged right now. It's been compromised seriously. So Rockland County is going to be hosting a blood drive next week, Wednesday, September 30th, between 8 a.m. and 5 p.m. Can we do walk-ons there, John, or do they prefer?
They prefer people register ahead of time, but if they have space, you are able to walk in. But to guarantee you can donate, you should make an appointment. Yeah,
that'd be a good idea. And that information, we're going to put that information on the comment section, right, John, of the after we're done here. But it'll be at the Building A, September 30th, which is Friday? Wednesday. Wednesday, okay. The flu shot's Friday.
Yes.
I'll get to that in a minute.
That's nice.
We're trying to help them here. So again, make the appointment if you can. This way, if you're going to go at a certain time, at least you know you're not going to be there for a time, an extended period of time. And again, just check the link that you see at the comment section, and we'll get that information right to you. And finally, as I went into it, the flu season is upon us. Let me find my documents on the flu season. Okay. Again, the flu season, no appointments are needed. This is where I was getting confused, obviously. Where our first clinic is going to be this coming Friday, September 25th. Now you know where I got that confused. I will be there, by the way, from 10 a.m. to 2 p.m. And the basic issues here, there's no appointments necessary. It's a drive-up, I believe they're doing this time?
It's a drive-up, or if you're taking public transportation, it is a walk-up, but it's all being done outside.
Okay, there you go. So there's no, you're not going to be in an enclosed area, except your own car. There's a $20 fee for those who are 6 months through 64 years old. A cash or check works fine. If you have private health insurance, they will give you a receipt so you can submit that for reimbursement. The vaccine is free of charge if, like me, you're over 65. If you have Medicare or Medicaid, and you need to bring your card, and if you're over 65, bring your identification. We are trusting here in county government, but somebody may ask you may say you look very young. You need to prove you're 65. You'll probably love that, so bring something with you to prove you're 65. If you're uninsured or underinsured also, there will be no cost to you. So that'll be this Friday, September 29th, between 10 a.m. and 2 p.m. I said I will be up there myself. Maybe I'll catch up to you there. But again, it's something, the flu, it's almost amazing that we almost are going to forget about the regular flu. The regular flu has killed. I mean, it can kill you. So people can get very ill from the flu and can pass away. So again, Rockland County has been #1 in health stats, the healthiest county in the state of New York 2 years in a row, despite the pandemic, despite the measles outbreak, because a lot of great work has been done by a health department to get these things out to people, to make sure that you have every opportunity to take care of yourself and be healthy. And at the end of the day, you want to get those senior discounts, stay healthy because you'll live longer. That's the best way. I can't put it any more simple than that. I hope I put a smile on somebody's face today. And with that, we're going to close out the show. And again, this is your County Executive Ed Day, signing off until next Tuesday.